Teeth whitening treatment process. During the appointment. If it is the first time the client has had a teeth whitening treatment with you, ask them to read the fact sheet and the client consent form before the consultation. Once the client is ready, have a consultation informing them of the information outlined in the training module titled The Consultation and answer any questions they have. Check the client has read, understands and has signed the consent form. Explain to your client that if they feel any sharp pain or extreme discomfort in their teeth or mouth, they should let you know straight away. If this occurs, stop the treatment immediately and ask your client to rinse thoroughly and remove any gel. Suggest they see a dentist, as this may be a sign of an outstanding dental condition. Treatment overview. Most clients will achieve maximum results in one visit. The teeth whitening will be done in 2 to 3 by 20-minute sessions. The reason for this is the gel peaks after 20 minutes and is no longer active. This gel must be removed and fresh gel applied to keep the whitening process going. A first-time client or someone with heavy staining will generally need a triple treatment. For someone who has teeth whitening every 3 to 4 months, only 2 treatments should be required. No pre-foams or gum barriers are required, as our treatment process is safe and gentle when followed correctly before the treatment. If the client has dry lips, they may apply lip balm or Vaseline. Just make sure the balm does not get on the teeth, as it will prevent the product from penetrating the stains in that area. Open your teeth shade set, decide with the client their current shade. You may like to write this down. When selecting the teeth shade with your client, always gauge from the darkest tooth. Use a well-lit area, preferably with natural light. The tooth shade chart is used to compare the color of the teeth before and after the teeth whitening treatment. The R20 is designed specifically for teeth whitening. It is arranged from lightest to darkest and numbered from 2 to 40. Each tooth model represents 2 shades, as this makes matching the color to the client's teeth easier. Your client will easily be able to see how many shades lighter their teeth have become at the end of the treatment. Now, offer the client their teeth whitening pack and explain the contents. Ask them to remove the disposable bib and put it on matte paper side up. You may like to assist the client with their bib and tie. This will protect the client's clothes in the event some saliva or gel escapes from their mouth during the treatment. Show the client how to use the cheek retractor using your demonstration model. This will hold their lips back from their teeth during the process. Have the client remove their cheek retractor from their bag and insert it as shown. The cheek retractor is held like a smile with the arch up and goes into the mouth, with the larger flanges sitting inside the mouth. Check the client's lips are not overhanging the cheek retractor, as this may allow their lips to touch the gel, causing discomfort, risking blisters and reducing the results. If the lips are overhanging, change the cheek retractor to a larger size. Next, the teeth will be wiped to ensure the gel has a clean surface to adhere to. Ask your client to open a finger wipe sachet and rub the front of their teeth. The wipe is used by placing their finger into the wipe and using the blue side on the teeth. Discard the wipe after use. Now, open the gel pen and twist until a gel ball appears on the brush head. Some pens will take more winding than others. The gel is applied beginning with the top teeth, making sure each tooth is thoroughly covered. Pay particular attention in between the teeth and go as close to the gum line as possible without getting any gel on the gum. The applicator will probably need twisting and reloading about every 2 to 3 teeth. Apply the gel to the front, visible, outer side of the top teeth. Then do the same for the bottom set. Do not apply the gel to the back teeth or behind the front teeth. The gel should be spread in an even coating. The application should be thick enough to properly cover the teeth without creating blobs, but not so thin it will dry out during the treatment. Using excess gel will not increase the results, it is just more likely to irritate the gums and the soft tissue of the mouth. Make sure all teeth are covered and none have been missed. Check to see there is no gel on the gums or soft tissue of the mouth. If there is, it can be removed with a cotton tip. Hand your client the protective eyewear and have them put them on. The protective goggles must be worn whenever the lamp is activated. Next, recline your client as much as possible. Recline is one of the most critical elements to getting good results. If the client is not fully reclined, they may drool and the saliva will wash the gel off the teeth and onto their soft tissue. This can reduce the results and cause irritation to the mouth and gums. Position the light head so it is pointing directly onto the exposed teeth, roughly 1 to 3 centimeters away from the cheek retractor. If the client is using a mobile device during the treatment check, they do not move their mouth away from the lamp. Turn on your accelerator lamp and set the timer for 20 minutes. Ask your client to relax and stay still. Remember to check on your client occasionally to ensure they have not moved their head and the lamp is still centered over their mouth. When the lamp finishes its 20-minute session, the light will automatically turn off. When the session is complete, ask your client to sit up and rinse their mouth to remove all the gel from their teeth. The gel will only remain active for around 20 minutes, so you will need a fresh application for the whitening process to continue. Repeat the treatment 2 more times for a new client and 1 more time for a client having maintenance or top-up treatment. After the final session, ensure the client rinses their mouth thoroughly until they have removed all remaining gel. Gel left in the mouth can cause aggravation, blisters and sensitivity. A vitamin E swab is provided to soothe the lips and gums after the treatment. To access the vitamin E from the swab, break at the red line, hold the swab with the red line to the top so the contents will drain into the end of the swab ready for use. If your client feels a slight sensitivity, you can offer them desensitization gel. Also, suggest they use a toothpaste for sensitive teeth for at least a few days. Now, work with the client and the shade guide to determine the client's new teeth color. Use the same tooth in the same well-lit area as before. This will remove variables from the result. You can then use the before and after results to determine how many shades whiter the client has achieved. In some cases, clients may notice a motley appearance to their teeth after the treatment. This is not caused by the treatment, it is fluorosis which is already present in the client's teeth. This enhancement of the condition will disappear within 1 to 24 hours. Finally, explain the white diet and aftercare requirements to your client and give them a copy of the aftercare sheet. It is important for the client to avoid staining foods for a minimum of 24 hours. Hot beverages, spicy foods and smoking must also be avoided after the treatment, as they have been linked to blisters and discomfort. Please follow all the instructions in this module to ensure the best possible experience for your client. Thank you for watching. Please enjoy the next teeth whitening training module. Disclaimer. Please note the information in this training is a general guide and has not taken into consideration your personal or business situation, insurance cover or any legal contradictions. We do not indemnify our clients against litigation. We recommend you seek your own independent legal advice and insurance when setting up your teeth whitening service.